Welcome back to New Day Northwest. Myopia or nearsightedness impacts billions of people around the globe, and it's on the rise. So many of us rely on glasses or contacts, which can be limiting and inconvenient. SharpeVision in Bellevue works with patients to correct their vision. Dr. Matthew Sharpe says a new FDA-approved vision correction procedure called EVO Visian ICL is here, and patients are seeing great results. I'm so excited to be here and talk with you about this procedure because I think so many people are going to be excited to hear about it. So first of all, tell us what EVO is and how it can help.
Well, the Visian EVO ICL is a permanent implantable contact lens, so we can place it in the eye rather than having to wear a contact lens on your eye and have all the annoyance of contact lenses and glasses.
Yeah, I hear people from here groaning about contact lenses. So it's implantable, a permanent contact lens. How does that work? What is the procedure like?
Well, the procedure itself is done here in the office. It's painless. It takes about 8 minutes per eye in my hands. It's something that patients will sit up from the table and say, I can see. It's that amazing.
Right away they can see?
It'll generally be foggy and gets much better over the week and month afterward, but is pretty clear the next day. Most people are 20/20 or better on day one postoperatively.
So, okay, I'm trying to imagine what a permanent contact lens looks like in someone's eye. So where do you place it?
Well, so it goes inside the eye. It's behind your iris, or the colored part of your eye. You can't see it. No one can see it. We can see, I can barely see it on the microscope once on postoperative day one, and it stays in there the rest of your life. It is removable if you ever needed it removed, which would typically be when you're much older, in your 60s or 70s, developing a cataract, then we can exchange it.
That's kind of nice that it is removable and it won't do damage. And this is obviously approved by the FDA now, and it's been cleared?
It's approved by the FDA. It's also been used outside the U.S. in over 1 million eyes it's implanted. So it's something that we borrow on techniques from cataract surgery and put the lens in the eye. It's a very simple and quick procedure. And patients feel nothing afterward.
Well, that's what I was going to ask you. You said it takes 8 minutes in your hands. So what is the recovery and downtime like?
The recovery and downtime is negligible. So patients will see them the next day. They'll typically have that 20/20 vision, but say it's a little foggy still, and then that gets better and better. There's no restrictions on activity, so patients can do whatever they want. We do have them put eye drops in their eyes to protect them and help them heal in the first week.
So they can still go work out, go about their life?
Exactly. Screen time's not an issue.
Oh.
Patients do not have the dry eye issue. They will be able to do anything they like immediately afterward.
So why could EVO be a better option for people than, let's say, Lasik, and how are they different?
Well, the EVO Visian ICL is just another tool in our armamentarium. It's an excellent tool. We also have Lasik and PRK, and so the only way to know for sure how you can get out of glasses, and most people can get out of glasses and contact lenses if they want to, just come to see us for a free comprehensive exam. We go over all the reasons for any given technology that we have, and then do the procedure so that they can live their lives free of the hassles of glasses and contacts.
I'm sure so many people who are watching out there are like, yes, I want that life, because it really, really is hard. Now, you have a patient here. One of your EVO lens recipients is your very own son, Max, and he's joining us. You were his doctor. So clearly you believe in this procedure enough to do it on your own son.
Very much so. You know, I had Lasik 24 years ago, so I've been a beneficiary of the technology that's allowed us to get out of glasses and contact lenses for a long time. So when Max started wearing glasses, and I think he was 7 years old, I gave him bad eyes, so I figured, why not correct them when the time came? So once we had the EVO technology, I said, this is the technology that I'd recommend for you based on his unique factors and amounts of nearsightedness and everything, and those are things we determine. But I think EVO's excellent technology, and indeed, he sees fantastically well right now.
Yeah, Max, what was day-to-day life before you got this procedure?
Yeah, well, I think anyone with contacts knows what the day-to-day life is like, the struggle, you know, the irritable eye, every night, every morning, having to take them out, put them in, and if you forget, you wake up with your eyes all scratchy and itchy, and then maybe you can't wear them for that day and say you need them. So also, another big thing was the stress of travel. With travel, you have to, you know, make sure you're bringing your eyes with you, and if you forget them, then you're out of luck. I play a lot of sports, so if, you know, I'm out on the field and a lens comes out, I'm out of luck. I can't play the rest of that game.
Wow. So now what is life like? That whole part of it has now been taken away.
Well, the day-to-day is amazing. You wake up every day and you see right away. That's the best part. But also, I would say the stress of travel, like not having that stress whatsoever, not having to worry about it during sports or anything, is amazing.
And for a consultation to see if EVO is a good choice for you, visit Dr. Sharpe at the website you see on your screen. We're also going to have all this information about how it all works, if you need a refresher on that, on our website. Well, my sugar rush from this morning is beginning to wear off, so there's only one thing left to do. Eat more cookies with Jenny of Jenny Cookies. She's back with party planning tips when we come back.
This portion of New Day Northwest is sponsored by Stars Surgical.